The respiratory system is composed of the airway passages, the lungs, and the associated blood vessels. The purpose of the respiratory system is to provide for oxygen and carbon dioxide exchange between air and blood. Respiration consists of 3 distinct processes. Ventilation is the movement of air from the atmosphere into and out of the lungs. Air must be taken in through the upper airway passages, comprising the nose, nasal passages, mouth, pharynx, and larynx. The air then proceeds from there into the lower airway, consisting of the trachea, the bronchi, and bronchioles of the lungs. The process of taking air in is called inspiration. Perfusion is the movement of blood through the lungs. Diffusion is the movement of gases between the roughly 1 million alveoli or air-filled sacs within the lungs and the capillaries that supply the alveoli. In diffusion, gases move across the alveolar capillary membrane. Oxygen moves from the air that is in the alveoli into the blood flowing through the pulmonary capillaries. Carbon dioxide passes from the blood into the alveoli. Completing the respiration process, the carbon dioxide is expelled through expiration. If respiration is impeded, gas exchange cannot occur. The body's supply of oxygen becomes insufficient for its needs, and carbon dioxide cannot be expelled from the blood. Asthma is a chronic reactive airway disorder characterized by increased resistance to airflow due to episodic airway obstruction. Asthma involves inflammation of the airways, bronchospasm, increased mucus secretion, and injury to the mucosal lining of the airways. Asthma can be characterized as extrinsic or intrinsic based on the factors that trigger the disorder. Extrinsic, atopic asthma, is initiated by a type 1 hypersensitivity response to an extrinsic antigen. An antigen binds with a mast cell and causes mast cell degranulation with release of histamine, leukotrienes, interleukins, and prostaglandins, resulting in inflammation and bronchospasm. This airway inflammation in turn produces airway edema, epithelial injury, and impaired mucociliary function. Intrinsic, non-atopic asthma is initiated by diverse non-immune mechanisms. However, many people have overlapping symptoms. Intrinsic asthma is triggered by irritant receptors and vagal reflex. Intrinsic asthma is often triggered by viral infections, inhaled irritants, NSAIDs, sulfites, and emotional stress. Asthma usually has its onset in childhood or adolescence. However, adults may develop asthma without a previous history of the disease. Asthma arises from a complex interaction between heredity and environmental factors and manifests as acute attacks. The early phase or acute response of asthma occurs within 10 to 20 minutes of exposure to a trigger. Mast cells, which in people with asthma are in a presensitized state, react to antigens and release histamine, leukotrienes, interleukins, and prostaglandins. With airborne antigens, the antigen binds to the mast cells on the mucosal surface of the airway. The release of inflammatory mediators leads to infiltration of inflammatory cells and allows the antigens to reach the submucosal mast cells. In addition, direct stimulation of parasympathetic receptors causes bronchospasm, and increased vascular permeability causes mucosal edema and increased mucus secretions. As airway obstruction progresses, expiration becomes prolonged. Late phase response develops 4 to 8 hours after exposure to an asthmatic trigger. Release of inflammatory mediators induces the migration and activation of other inflammatory cells, basophils, eosinophils, and neutrophils. The late phase response involves inflammation, increased airway responsiveness, and renewed bronchospasm. These symptoms lead to further airflow limitation and continued heightened airway responsiveness. This sequence prolongs the asthma attack and sets into motion a vicious cycle of exacerbations including additional edema, epithelial injury, and impaired mucociliary function. Treatment for all asthma patients is approached in two ways: through control of factors contributing to asthma severity, and through pharmacologic treatment. If exposure to triggers can't be avoided, then pharmacologic treatment is usually needed. This can include corticosteroids, bronchodilators, mast cell stabilizers, beta agonists, and anticholinergic drugs. Asthma is a chronic reactive airway disorder characterized by increased resistance to airflow due to obstruction of the airway passages. Asthma involves a hypersensitivity reaction to stimuli and the release of chemical mediators from presensitized mast cells, leading to a vicious cycle of edema, epithelial injury, and impaired mucociliary function.